There's a place for prescription medication when you get a cough and cold. Generally, always first try with the non-prescription medications. But if the over-the-counter cough medicine is just not strong enough that you can get some sleep with, then it's worthwhile seeing your doctor to about getting a stronger medication. Most of the prescription cough medicines have codeine in it or some sort of mild narcotic. So that may be something you may not want to take during the day or take when you're driving. But you certainly could mix those. You could certainly use the prescription stronger cough medicines at night when you want to make sure you can get some sleep, with the over-the-counter medication during the day when you want to make sure you're awake. Antibiotics usually are not indicated for a cough or cold. But usually, even when there's some sinus pain and sinus pressure, it's almost always a viral and you don't need antibiotics. For a bronchitis, once you start bringing up some greenish phlegm, studies have actually shown, yes, those things are usually not bacterial either. They're viral infections. And when you're using a kind of a cough medicine that will thin out the phlegm, like a Robitussin, a Cheritosin, a Mucinex, is all that you're going to need. Again, one other over-the-counter medication you might throw in there is, yes, drink plenty of fluids, but particularly warm fluids, like a warm tea, because just the warmth of the fluid is going to thin out this phlegm and is going to come up easier on its own. Of course, if you start running a fever, the fever of 101 or 100 to 101 is considered normal. In fact, it's the body's way of fighting off the infection. I've actually done studies in those people who run a fever or actually and let themselves run a fever, actually get better faster. Your dad used to do this. He used to, when he was sick, usually he would go to bed with a hot toddy and throw on the blankets and just sweat it off. And yeah, that works. But certainly if the fever gets over 101, or the illness goes longer than 2 weeks, you certainly may need an antibiotic, and for that you're going to have to see your doctor to evaluate for that. What's a bronchitis? It's basically an infection that starts off usually just like a cold, only it just seems to hang inside the bronchial tube. And one thing is it may cause enough inflammation and swelling in the bronchial tube that you actually wheeze like an asthmatic and stuff. For those things, using an asthma medication is sometimes beneficial. Again, you'll have to see your doctor for that. That's usually a diagnosis that's made by my stethoscope. I hear the wheezing, and I know that they need something to help relieve that inflammation.
Medtwice.com